Bismillah ar-Rahman ar-Rahim. Good afternoon, everyone. I'm Dr. Rabab Al-Attas, and it's my pleasure to share to co-chair, in fact, this session with my colleague, Dr. Noor Al-Muzayyin. We will have a very exciting session with very distinct speakers. The first speaker, which I'm going to introduce her, is Dr. Salwa Hindawi. Dr. Salwa is a professor in hematology and transfusion medicine at King Abdulaziz University. Dr. Salwa is certified both in hematology and transfusion medicine by MRC Path and FRC Path. She is also a member, in fact, of many prestigious societies, and she's actually president of some of them, including some, not all, is the WHO, ECPS, the Expert Committee to Biological Standardization, the Saudi Thalassemia, Sickle Cell Anemia, the Saudi Society of Transfusion Medicine, and she is the AABB as well. Dr. Salwa is an editor and a board member of many journals, national as well as the international, like the Indian Society of Blood Transfusion and Immunotherapy. Dr. Salwa is gonna talk to us about the impact of the COVID infection on the transfusion medicine. Dr. Salwa, please go ahead.
Thank you, Dr. Rabab. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, everyone. I just like to start with thanks to the organizing committee for inviting me today. And my talk today, as Dr. Rabab said, on the impact of COVID-19 on blood supply. This presentation is supported by Bristol Myers Company. Just get me to the slides. Okay, I'll start with introduction, some challenges, local experience and strategies for management, then conclusion. Blood supply, we, through the WHO, the reporting on 2018 worldwide that there are 118.5 million blood donation collected globally. 40% of this blood donation is in the high-income countries, and this in high-income countries are the home for 16% only of the world population. The world blood donation rate is an indicator for the general availability of blood in any country. The median blood donation rate in high-income countries is 31.5 donation per 1,000 people. Upper middle income is 15.9 donation per 1,000 people. For low middle income countries and low income countries, it is below average and it's 6.8 and 5. And this is not, the supply is not equal to the demand. There, the demand is superior to the supply in these countries. In general, we know that transmission of SARS-CoV-2 via transfusion has not been reported up till now. And it's currently considered highly unlikely. As we know, the transmission mode is by direct contact and respiratory and other modes, but not yet any report by blood transfusion. Coronavirus disease pandemic had a significant impact on the blood supply around the world, especially at the beginning of the pandemic. There are reports by American Red Cross, as example, that they have dropped by fewer blood donation 200,000 and 6,000 blood drives canceled. The blood supply chain, we know that it is having part of it as for the product itself and part of it for the patient. This means part for the supply, part for the demand. And products, content of products part is the recruitment and collection of blood donation, testing and processing and storage. For the patient is ordering the delivery of correct blood to the patient, administering blood to the patient, and this all affected during the pandemic. In this figure or graphs, we can see the report of WHO organization on September 30, 2021, about the total cases reported globally, and it is arrived around 235 million, and this is around 5 million globally. And there are many waves happening and occurring since the beginning of COVID-19 pandemic in 2020 around the world, and more than 100 variants discovered around the world. In Saudi Arabia, situation is a little bit better now, and we had a total of 547 confirmed cases and around 8,727 deaths by 30th of September. And we can see from the graph that we have dropping of the cases and improved situation in our country. And this luckily because of the control of the authorities and Ministry of Health. There are many challenges around the world facing us usually for the blood supply, but also the COVID-19 increases challenges. Donor supply is reducing and challenging for donor supply, that we have to maintain constant supply of donor, and we have to ensure that all blood groups, including rare types, are represented. And donor health is important, and we need to have a policy that protects donor health. And one option for that we can try to increase supply by interdonation, reduce interdonation interval. One study showed that it is not a good choice on the long term, as it's not long-term solution. It can affect donor health. Other challenges which all of us we know and we pass through it in blood transfusion centers, related to donor challenges like social distancing and travel restriction, illness, self-isolation, need to care for family members, and fear of acquiring COVID-19 during donation. Cancellation of blood donation campaign also affecting remote areas in certain countries owing to travel restriction, and reduced capacity at donor centers due to COVID-19 precaution, staff being sick or on sick leave, self-quarantine, and application of social distancing to donor also affect that. Also, there is in certain centers, there are collection of the plasma from recovered COVID-19 patient, and this led to diversion of blood and staff to service related to that. This is affecting the usual collection. Blood processing and supply chain disruption due to restriction of travel and the transportation, affecting the supply of critical materials and machines needed and lead to shortage. Supply doesn't always meet demand. There are chronic worldwide blood shortage, and the World Health Organization estimates that resources limited country to be improved in their supply, they have to have more than 10 donors per 1,000 inhabitants to be collected annually. Many low-income countries don't reach this target. In this graph, you can see that most of the donation is in the high-income countries and low-middle-income countries, as I stated before. The impact of transfusion on chronic disease also affecting demand and supply. Transfusion-dependent patients have experienced blood supply shortage, and the patient may have postponed their own transfusion clinic because they are having the fear of COVID-19, acquiring COVID-19 from the hospital. And also the capacity of some transfusion service has been reduced owing to COVID-19 safety precaution and staff shortage, and this results in postponed of transfusion appointment in some cases, or I can say in many cases. Blood service organization face pressure in maintaining sufficient blood to meet demand. And the treatment of chronic anemias in general places a considerable additional strain to the blood supply. As example, in Greece, 20 to 30% of their annual blood supply is used to transfuse around 3,000 patients with thalassemia and sickle cell anemia annually. I will just state some example of local experience and about a few studies, because if we can just look around, there's a lot of studies happening worldwide on supply and demand and the impact of COVID-19. And this is happening everywhere in US, UK, Europe in general, all regions of the world, and locally at Saudi Arabia. If I can start with Saudi Arabia with one study done by Yahya Ammar, who is, or Ammar Yahya, and published in Transfusion Science in 2020. It's about management of blood supply and demand during the COVID-19 pandemic in King Abdullah Hospital, Bisha. A retrospective study from this hospital in Bisha revealed a decrease in blood flow or supply in blood banks by 39.5% during the pandemic, in contrast to the demand, which was decreased during the same period by 21.7%. And this likely secondary to cancellation of many surgeries due to occupation of the hospital with COVID-19 patients. But even though this shows that the supply is decreased more than the demand in that period, another study from African region by Andrew Loa, which is from the Regional Office of Africa. It's published in Vox Sanguinis. Also the impact of COVID-19 pandemic on blood supply and demand. A survey questionnaires was sent to all 47 countries in WHO African region to collect information on blood supply and demand for the first 5 months of 2019 and 2020, respectively, and on COVID-19 convalescent plasma therapy in September 2020. In conclusion, this study showed that the pandemic had led to a reduction of blood-related activities in the region in most of the country, including the supply and demand. Countries' preparedness plan for health emergency need more emphasis to maintain blood stock. Another study by our group at King Abdulaziz University Hospital by Saud Al-Malki and colleagues. It's about awareness about coronavirus and challenges for blood service among potential blood donors. The aim of the study to assess knowledge and awareness of blood donor about COVID-19, and the method was by survey, including 27 questions. A total number of 3,841 persons responded. 58 of them were between age of 31 and 50. More than 60% of participants donated blood previously. In conclusion, the fear of contracting COVID-19, secondary to concern about contact with other blood donors and staff, was the main limiting factor to blood donation. Now I'll just go to some of the important strategies for management, and starting with saying that during an emerging pandemic, any pandemic, it's too late to think about the implementation of new strategies or technique. And we have to be prepared, and we have to have a plan for this future pandemic. Strategies, there are here 6 strategies which we may think about more than this, but this is important strategies for blood supply specifically and demand. And it's starting from donor recruitment, eligibility, protection of staff, and inventory management, production modification, and patient blood management. First strategy about donor recruitment, we have to encourage donation. During pandemic, we can do invitation to donate, call donors from our database, the usual donors we know. We can just allow transportation for donor to facilitate their arriving to our centers. We have to depend on media for awareness and education, and just to allow donors knowing what is the situation and how they can participate from the society. Extension of working hours will help, and change age demographic of donors may help also. Awareness campaign has to be encouraged. Donor eligibility, we have to have donor selection criteria relaxation. We may just relax the criteria, and it's done already in many countries. And also we did it locally in few of the criteria which will not affect safety of the donor. Deferral period should be applied for confirmed or suspected cases, for travel in countries region at high risk, and for exposure to confirmed cases of COVID-19. Eligibility criteria for COVID-19 has to consider that persons with possible direct contact with COVID-19 patients are temporarily deferred. Positive COVID-19 donors are deferred for 14 days after their last negative result or complete recovery. Donor with pending COVID-19 test result has been deferred until the results are completed and just discover if it is negative or positive. And also for the vaccination, which a lot of people asking the vaccines, donor who had vaccination, which is based on RNA vaccination, it is okay to donate at any time, but patients who get a live attenuated vaccine, they should be deferred for 4 weeks. Protection of staff and donors, as we know, the social distancing helping a lot for protection with the using of masks, as we know, and also washing hands, encourage donation by appointment, and environmental decontamination, sanitation of all materials used before and after donation, all will help in the protection of donor and staff. Inventory management is an important strategy at any time, and especially during pandemic or disaster. We have to have a regular update of inventory. We have to plan for emergency and disaster. We have to increase the efficiency at donation center, and the product availability. We have to plan for inventory level, timing of deliveries, and order review. Product integrity is important also to minimize wastage. And we can just see the references. There is an important reference from Australia on managing blood and blood product inventory. If you can go back to it, you can learn a lot from it. And you can use some of their methods to help you and discover. This is an example of one method, just to know your inventory by today, how it will help you and how many days it will cover. And it's easy to calculate it through this equation, just for anyone who wants to look at it, and you can go to the reference path. Product safety, also strategy to modify production, specification, and storage of blood component to help prevent blood shortage is very important. Modifying of production of the red blood cell platelets and plasma. You may use the whole blood in certain indications. You may just use the platelets and increase shelf life from 5 to 7 days. You can just reduce the dose of platelets in prophylaxis situation. All this can help in if you modify the specification. Storage of plasma, you may use the liquid plasma in certain indication. Also, all of this will help in products. Donor selection and hemovigilance remain important tool to protect patients receiving donor blood and also to protect donors and staff. Pathogen inactivation methods help a lot in just get rid of or reduce non-pathogen and also COVID-19 or SARS-CoV-2. Here I'm showing you 2 of our studies which we did for SARS-CoV-2 inactivation at our center. We had one we used amoxicillin and ultraviolet light treatment, and we use it for both plasma and platelets. And this 2 publication, it's already done the study and it was successfully. And the conclusion of the study is that the SARS-CoV-2 was efficiently inactivated in platelets concentrates by amoxicillin and UV light treatment. And the results are in line with previous inactivation data for SARS-CoV-2 in plasma, as well as MERS, as well as SARS-CoV-1 in platelets and plasma, demonstrating efficient inactivation in human coronavirus. And if you can see here, you can see that the negative control is equal to post inactivation. And this just demonstrates it is efficient. And if any possibility of transmission, this can get rid of it. Last strategy I will talk about it today is the patient blood management. I will not just give details on patient blood management, but I will highlight on it. Patient blood management primarily aims to improve patient outcome, and it can significantly reduce the use of blood products and save health costs. By implementing patient blood management, we can find that it is a key to rethinking blood use and should substantially reduce blood demands, and we may reach the demand equivalent to supply. By using alternative to blood transfusion and approach to improve patient outcome and optimize transfusion, this will help a lot. And alternative to blood, such as synthetic oxygen carrier genetic gene therapy for inherited disease, and using of novel techniques and management, like application of artificial intelligence through data modeling to improve supply-demand chain. We have a few studies which succeed in just getting this model, and they have used the artificial intelligence to improve the supply and demand. And there is still studies going on about this to help and increase and improve the supply of blood. Evidence-based approved treatment options to manage anemia and reduce transfusion dependency is needed. And I will give you one example of this study and this medication who can help. We can say that the luspatercept is a first-in-class erythroid maturation agent that overcome ineffective erythropoiesis in beta thalassemia. And the mode of action of this drug is that it is it is an recombinant fusion protein consisting of modified form of the extracellular domain of the human activin receptor type 2B. And mode of action is that it binds to select transforming growth factor beta superfamily ligand, leading to enhancing late-stage erythropoiesis. In two studies which called the BELIEVE study, they showed that during week 13 to 24 as a primary endpoint, that it is having 33% reduction from baseline, and during any 12 or 24-week interval as an endpoint, it showed that it is effective to reduce the burden of transfusion by 33% up till 50%. And it is generally safe and well tolerated. In summary, this luspatercept significantly reduced red blood cell transfusion burden in patients with beta thalassemia, and also it can be used in MDS. Luspatercept reduced marker of iron overload and in generally safe and well tolerated. This published by Caplini and group and by Herman and his group in 2020 and 2018. We can say now it is registered by Saudi FDA and it should be available. In conclusion, building and maintaining trust between donor and collection center is essential to maintain an adequate and safe blood supply. Establishment of national blood system with well-organized and coordinated blood transfusion services that can provide sufficient and timely supply of safe blood and blood products to meet the transfusion needed of all patients is very important. And workers in blood collection centers must receive continuous education and up-to-date accurate information about the status of the pandemic. Collaboration is very important among collection centers, and sharing experience and learned lessons from each other, even nationally or internationally, from this pandemic is expected to help plan and manage current and future crises affecting the blood supply. Lesson learned, or the final thoughts, there is a need to continue supporting countries through strengthening capacity of national blood transfusion system through collaboration between WHO, country official, and other stakeholders. Enhancing risk mitigation is important. The use of novel techniques and therapies are encouraged. Blood services must be prepared to move quickly in response to changes in future pandemic situation. Thank you.
Thank you very much, Professor Salwa. And we have, and thank you for ending exactly on time. If there is any question, now we have full 5 minutes for any questions. Okay, may I ask a question then? Dr. Salwa, you mentioned that the most important impact of COVID on blood transfusion is the decrease the supplies, basically because of the pandemic itself and the shortage of donors. Now, in your studies, you have inactivated some of these viruses in the blood products. Was it because this has been, these patients had been, or this collection of blood was drawn without testing the patients, or before the pandemic was obvious? And do you recommend this way of inactivation as a routine now?
Yes, it's a good question. Thank you. No, this, till today, as I said, there is no evidence that COVID or SARS-CoV-2 is transmitted by transfusion, but just as a precaution. We know that pathogen inactivation is helped in reduction and inactivate many of pathogens around the world. And we prove that, and others also internationally prove that it is effective against reducing the pathogen in blood supply. But for this COVID-19 or SARS-CoV-2, we inoculate the virus itself in the products, and we inactivate it just to make sure that it can activate it if it will be in the blood. We know that in general, there is some studies show that the SARS-CoV-2 is present in the blood and even in platelets of some of the donors. And that's let us just a little bit worry. And just to get worry out, I recommend that if it is possible, you can use the pathogen inactivation to just get rid of this virus or other viruses after testing. For SARS-CoV-2, we know that there is no testing for routine donors, and we can't test every donor for SARS-CoV-2 if it is there or not. We need to just do pathogen inactivation in case if it will be transmitted in any case. And this will help all, even we know that pathogen activation will help bacterial also reduction and just inactivate bacteria in platelets. And we are using it actually in certain centers routinely for platelets. This encourages us to use it for also plasma, and we can use it for plasma to inactivate COVID or SARS-CoV coronavirus 2 or others viruses. And I recommended yes, but if it's possible and because of the cost, if it is nationally had what for every center, this will be much better, and this will reduce the cost on any hospital or any center. Thank you.
Dr. Rabab.
Okay, thank you very much. Thank you very much, Dr. Salwa, and we'll move to the next speaker.